anatomical station showing the picture of heart. So when you see this, we have to identify the vessels. We are seeing this. These are coronary vessels. Left anterior descending, right coronary, left circumflex. So this is the anterior descending, means this is one ventricle, right ventricle, this is left ventricle, this is the right atrium. So right atrium has to be above. So when this is the right atrium and this is the vessel, atrioventricular groove, and this is the right coronary artery. So this is left so this is right ventricle, this is left ventricle. So left ventricle, the right ventricular, and this is pulmonary trunk. So here you are seeing this one is the right ventricle and pulmonary trunk is continued like this, and this is the left ventricle and it goes from here. This one is the arch of aorta, so on the right side, and this is on the left side. So this is brachiocephalic, and then brachiocephalic turns into common carotid above and subclavian, while on the left side the arch of aorta goes like this, and common carotid goes up, subclavian goes like this. So this is arch of aorta, descending aorta. Now this is right atrium. So right atrium has got superior vena cava and the inferior vena cava. Both opens into right atrium. From there it goes to right ventricle. Blood flows like this. Then all these from pulmonary trunk it goes into pulmonary arteries, into the lungs. From the lungs, the pulmonary veins, it goes into left atrium to left ventricle. That is the way of flow. So structures I already labeled demonstrate surface marking of the heart. Now the surface marking of the heart, how to do? Because if you get ribs like this, suppose if you get ribs, there will be a sternum, then this is junction is the second rib, third rib, fourth rib, fifth and sixth. Then there is the, so how to start? This is the junction, sternal angle. So this is the second space. From this is one point, take one point on this right side, take the same on the left side, then one on the fourth intercostal space or the sternum. This is the right border, superior, the fifth intercostal in this way. Surface marking. Lower border of third costal cartilage, the right side of the sternum, lower border of sixth, right side sternum, then fifth space in the mid-clavicle line is the apex. So what are the surface marking of tracheal carina? So tracheal carina, bifurcates left at the level of manubrium sternum. Actually it is at the level of manubrium. What are the layers that you would like to go when inserting the chest drain? So this is for the chest drain. So you are going to the chest drain means you are going to the skin, then subcutaneous tissue, you go to the skin, subcutaneous tissue, then you go deep fascia, then you go external serratus anterior, then external intercostal muscle, internal intercostal muscle, then innermost intercostal muscle, endothoracic fascia. These are the layers. Then you go the pleura. In which plane do the intercostal vessels run? So it is in between the internal intercostal and innermost intercostal. So muscle layers of chest wall, compare the muscle layer of the chest wall. So the muscle layer of chest wall divided into three layers: outermost, external, internal and innermost intercostal. In which direction external intercostal It's down just like the pockets in the hand. External fibers. What are the surface marking of parietal pleura? Again, now when you see the X-ray, if this is suppose the X-ray, parietal pleura, 6th, 8th, and 10th space. So, are there areas where pleural cavity is not protected by the rib cage? So, pleural cavity extends upward first rib anteriorly above the first rib and posteriorly below the lower part of 12th ribs. So, this one is another station. What is this? This is a contrast bronchogram. So, you see this one is the trachea, this is the right bronchus, left bronchus. So, upper and lower left bronchus is little bit horizontal. So A is the left main bronchus, B is the right main bronchus, E is the right upper, and C is the right intermediate bronchus. So right, which is the main bronchus? So to inhale foreign body is the right bronchus. How many lobes do the lungs have? Right has got 10 and left has got 9. How many bronchopulmonary segments? So right has got 3, left has got 2, and bronchopulmonary segment 9 and 10. So this one is the another picture which shows VAB, vein, artery, and bronchus. Vein, pulmonary artery, bronchus from anterior to posterior, and this is the impression of the aorta. On the left side, this is anteriorly is the phrenic nerve, posteriorly is the vagus nerve. So H is the vagus nerve and G is the phrenic nerve, and this is the heart, is the liver and duodenum. So when you see the impression, what is that? The impression what is the structure impression DNR former? Which side of the lung is, how to identify which is his side? So basically, when there is the impression of aorta, it's on the left side. And this is the liver, spleen on the right side. Which structure causes impression D and F? So D and F, F is the heart and D is aorta. What nerves lies position G and H? What are the structure level A to C? We have measured. What surface marking of the lung fissures? So T2, it's the level of T2. So this one is the picture of sternum. A is the jugular notch, B is the manubrium. So here is the manubrium. So T2, third thoracic, T4, and this is the sternal angle. Here is the second rib. Sternal angle, manubrium, jugular notch, body, and the xiphoid. Parts of the bone. To which thoracic vertebral levels are different parts of the bone. So now this sternal angle is T4, T2 to T4 is this, T8 at the zip, and T9. What is the motor supply of the diaphragm? C3, 4, 5, diaphragm lives alive. What spinal root does nerve arises? Fifth one, the question number 5th. C5, 3, 4. What is the nerve supply of diaphragm? C3, 4, 5. What nerve supply sensation to diaphragm? Intercostal muscle supply T5 to T11. From what spinal levels does these nerves arise? T5 to T11. So arteries, which are the arteries? Which is the blood supply of the diaphragm? So superior inferior phrenic arteries, musculophrenic arteries, and contraction intercostal arteries pass through the diaphragm at which level? Voice of America. So inferior vena cava, esophagus, and aorta. So this is the mammography, anatomy of the breast parenchyma. Female breast is extending the lactiferous duct, and then they open it, and there's got a structure. Pattern of lymphatic drainage of the breast. So NH general root, axial lymph nodes are drained, anterior, middle, posterior, from level 1 to level 2, level 2, 3. So boundaries of the breast, it lies base of the breast circulates in lateral wall of the sternum to the mid-axillary line. Second rib to the sixth rib. What is the blood supply to the breast? Intercostal. We receive blood supply from internal mammary artery, intercostal branches, lateral thoracic artery, perforating branches. The sensory nerve supply of the breast skin is supplied by supraclavicular nerve, lateral cutaneous nerve, anterior thoracic nerve, perforating cutaneous branches, intercostal nerves. Nerve supply sensation to the nipple. Nerve supply and sensation to the nipple. So this nipple has got fourth intercostal nerve. Breast is a modified type of sweat gland, apocrine gland. So this one is a typical rib, and a typical rib from right side. So how to understand this? Because this is articulating with the spine, and this is spine, and this one is a superior surface. Superior surface of the typical rib from the right side happens to be the eighth rib. Note the upper surface is blunt, whereas inferior surface has a sharp edge. So this upper surface is blunt. So this one is the costal part, this is the vertebral part. Vertebral has got A, B, tubercle with the A is the head, B is the neck, and C is the tubercle, E is the angle, and D is the shaft. Attaches to the F. F is the sternum. What attaches to F? The costal cartilage. What articulates with the point C? Now if you see point C, tubercle facet articulation with the transverse process of the corresponding vertebrae. What movements do the rib movement during respiration? So intercostal muscle, this increases the transverse diameter of the chest. Bucket handle movement. So this is bucket handle. So this is typically the first rib, and top of the first rib is again the head, neck, tubercle, and it has got scalenus muscle. These are the three structures. Scalenus tubercle, D is the scalenus tubercle. So scalenus anticus and scalenus medius is anterior is, so F is artery and E is the subclavian vein. So this is anterior, this is posterior, and G is the brachial. G structures that passes from the G. So T1 nerve roots in contact with the G, and H has got muscle which is attached to the F. H is scalenus medius. Is the CT scan at the level of chest. Now what has to be done here, you have to identify this is supposed to be this is the ascending aorta, and this is descending aorta, and this is pulmonary trunk. So right pulmonary artery, right RP, right pulmonary artery. Now if you see, this is the vertebral body, maybe the T5 level. It's just the T4, T5 at the level of sternum. This is the sternal angle. This is sternum. This is left side. So if this is left, then it has to be left pulmonary artery. This is left side, and this is right side. So here this artery is going like this. Aorta is arising from here. Pulmonary trunk is like this. It's going there. Then the E is supposed to be the superior vena cava. So superior and inferior vena cava is here, going down. Then M is pulmonary vein. This one is right side pulmonary vein, and this one is the right sided vein bronchus, and this is G is the left It is one bronchus here, another bronchus here. So lungs is black colored lungs. So two bronchi, and this H has to be the esophagus behind, and actually trachea is not seen because bronchus is there. And I is, this I can be supposed to be a zygous vein. So here is the azygous vein. Now this one is descending aorta. Behind this right side is the azygous vein. So you are seeing it from below. Now what are the questions? Identify the structure. Then what is the blood supply of the esophagus? So esophagus has got a blood supply. Upper esophageal superior is from the inferior thyroid artery, superior part, and middle part from the descending branches from the aorta, and the lower part from the left gastric artery. Next question: what constitutions occurs in the esophagus? So esophagus actually has got a CABG, CABG. So cricoid, aorta, bronchus, and the gastric. So it starts from 15 upper esophagus, arch of aorta, then main bronchus, and the diaphragmatic. Through what structure would the needle pass during subclavian vein cannulation? Now you are just trying to put a cannula into subclavian vein. So it will start from skin, subcutaneous tissue, deep fascia, cervical head of pectoralis major, clavicular head. It has to be going to the pectoralis major because clavicle is already there. Clavipectoral fascia, subclavius, and the subclavian wall. What structure at least during subclavian vein cannulation? If you are trying to do cannulation of this vein, what structures? It can be subclavian surrounding structure, artery, phrenic nerve, apex, thoracic duct. So you get, now we are starting, this is the abdomen IV intra. You can see what you see. This is the pylography, but it is having the catheter inside. So this is retrograde pylogram. So this is left side, this one is right side. So you see left side, A and B is ureter, left ureter, right ureter. D is pelviuretic junction. These are the minor calyces. This is the pelvis. E is supposed to be the papillae, renal papillae. And G is, this is the shadow of psoas muscle. G is the shadow of psoas muscle. Then you get this one is the bladder. So the renal papillae project into minor. So what are the questions again? Then what is in a retrograde pyelogram? A to F. What structure faint line? G is the saw shadow. What causes cup shaped level H? So this cup, this is compression on the renal papillae. So H is called renal papillae projection into minor calyces. So describe the course of ureter and what are its relations. The course of ureter, how does it passes? So you can see this is the ureter. It starts from the level of L1, L2 something. Then most actually it has got vein, artery, and pelvis. Pelvis is anteriormost. So when you're trying to dissect the renal stone, pelvis has to be anterior, then artery and vein. Vein, artery, and pelvis from posterior is the pelvis. So the abdomen descends down vertically downwards anterior to psoas muscle and overlap the transverse process of the vertebrae. So these are the transverse process. picture of, you see sometimes this shining is the external oblique aponeurosis. This is external oblique aponeurosis is cut and withdrawn like this in this direction. So this is generally, this is somewhere near the pubic tubercle, anterior superior leg spine. This is the thigh, and below the ligament this is the femoral area. So when you cut this, so you get a, this is the vessel, inferior epigastric vessels. Here you get the rectus muscle, and here is the superficial inguinal ring has to be here, and this is the anterior superior leg spine, pubic tubercle, and this is the midpoint of inguinal ligament, and this is the location for the deep inguinal ring. So another point is that mid-inguinal point is anterior superior leg spine and the center of the pubic symphysis, and the center is just in correspondence with the femoral artery. So midpoint of inguinal ligament and mid-inguinal point, these two are separate. So what you see is that when you open this, you get a, this one is the cord-like structure. It is called a spermatic cord, and it has got various layers. When you're doing the hernia surgery, you open the external oblique aponeurosis, then you say get this spermatic cord. Then the sac has to be identified in this. If the sac is coming from the deep ring, it's supposed to be like this. From the peritoneum inside, it is protruding and it's coming along with this, it's like this. So that is indirect inguinal hernia. And if this is inferior epigastric vessel, if the sac is protruding from here directly, not in from this medial, so that is direct inguinal hernia. So here what you see, identify the structure A, B, C. So what you see, A is the spermatic cord, this I already told. B is the external oblique aponeurosis, and C is this inferior epigastric vessels, and D is supposed to be the deep inguinal ring, and E the location of superficial inguinal ring. So it's like this, superficial inguinal ring. Now what is represented by D is deep and V shape is superficial. From which side of the body is this? This is the left side, because this is left side. Now what is inguinal canal? It's a tube-like structure, it's just a tunnel and cleft-like space entirely between the layers of abdominal wall, 2 cm wide, runs parallel to the inguinal ligament. So what are the boundaries? How the boundaries? So you get anterior, posterior, superior, inferior. So anteriorly is external oblique aponeurosis, then reinforced laterally by internal oblique. Posteriorly transverse fascia and laterally and conjoint and medially. So inferiorly you get a rolled edges of the external oblique muscle. Superiorly you get the, so then what runs through the inguinal canal? So actually the thing means spermatic cord is the basic thing, and round ligament in the females, and ilioinguinal nerve. What is mid-inguinal point? I told mid-point of inguinal ligament. What are the layers of the spermatic cord? Now, this layers of the spinal spermatic cord. So first is what are the contents of spermatic cord? So it starts from the scrotum derived from the abdominal skin, then that dartos fascia, that is campus, then you get dartos muscle is there, then dartos fascia is there, the external spermatic fascia is a continuation of external oblique aponeurosis, cremastic fascia is continuation internal oblique, and internal spermatic fascia is transversus fascia. Then you get a peritoneum or this tunica vaginalis. So contents, again there are 3 arteries, testicular, cremastic and artery to the vas, and 3 nerves, sympathetic, parasympathetic, genitofemoral nerve, vas difference, 3 other structure, pampinea, frontal vas difference, and lymphatic vessels. Fate of the right and left testicular veins. So the right testicular vein goes into the renal vein, and right gonadal vein goes into the inferior vena cava, left testicular vein goes into the renal vein. What is clinical relevance of this? Because entry right testicular vein into inferior vena cava less likely to backflow. So that is the thing. So this is another picture where you see a CT scan. This one is the right side, this one is the left side. So you see this one is the right kidney, this one is the left kidney, and you see this is the renal pelvis, and here the liver is there like this. Then you get a stomach in the anterior side. Then you see the right sided, there is a left side, there will be aorta. H should be the descending aorta or aorta. N should be the inferior vena cava. J is supposed to be the inferior vena cava, and N is supposed to be the psoas muscle. This is the muscle on both sides, so that's why N is psoas. This is aorta, this is inferior vena cava. Then in front of the kidney, you see M, G, K. So M is the duodenum. This is the second part of the duodenum going, and G is supposed to be the pancreas. It is a horizontal form. Then K is superior mesenteric vein, and P is the, what you see is, P is the superior mesenteric artery. So superior mesenteric artery. Then you see these stomach and ease. This one is a spleen on this side. This one is a liver, and these are the rectus muscles. This is left rectus, right rectus. So when you are seeing left, what is the transpyloric plane? What are the structures? Transpyloric plane is at the level of L1. It is L1. The structures are spinal cord terminates at L1 level. Then aorta is use of superior mesenteric. At L1 you get superior mesenteric artery, SMA. The lateral motor artery crosses the costal margin, DJ junction, L1 vertebra, neck of the pancreas, hilar of the kidney, and portal vein is formed. Describe the venous blood supply to the stomach. Now again, the stomach has got, so you see, you just remember this is stomach, and the blood vessels are the celiac artery. It's giving rise to common hepatic and left gastric, and from here you get right gastric. Then you get a gastroduodenal artery, gastroepiploic, and then from here the splenic artery is there. Then again short gastric arteries are here, and left gastroepiploic. This one is right gastroepiploic, left gastroepiploic. So this is the blood supply of the stomach as well as duodenum. Blood supply of the pancreas, again from gastroduodenal, superior pancreaticoduodenal, inferior pancreaticoduodenal from the inferior mesenteric artery. What is the lumbar plexus and what muscles are? So what are the structures? Sites of portal systemic anesthesia. There are 6 sites at the level of esophagus, lower end of the esophagus, at the level of umbilicus, rectum, retroperitoneum. This guy, the origin path in the superior mesenteric artery. Superior mesenteric artery arises at the level of L1, then arises transpyloric plane, passes anterior to inferior process of pancreas and third part of duodenum, and pancreas duodenum wrapped around inferior pancreatic duodenal, middle colic, right colic. So superior mesenteric gives rise to this middle colic, right colic. Middle colic is above, right colic and ileocolic arteries, then jejunal arteries, and inferior mesenteric is to the left colic. Duodenum is basically supplied by pancreaticoduodenal. Blood supply of the pancreas again is by the splenic artery in front of the pancreas. The nerves of the lumbar plexus are divided according to, so iliohypogastrik, ilioinguinal, lateral are iliohypogastrik, ilioinguinal and lateral cutaneous nerve of the thigh and femoral nerve. So when you see the lateral nerves, iliohypogastrik, ilioinguinal, lateral cutaneous nerve of the thigh and the femoral nerve, these are the lateral nerves. Anteriorly you get genitofemoral nerve, medially you get obturator and lumbosacral trunk. So L1 to L5, these are the lumbar plexus. 4 above, 2 anterior, 2 medial, 1 anterior. So this one is a double contrast. You say get cecum. This one is the cecum, ascending colon, hepatic flexure, transverse colon, splenic flexure, descending colon, sigmoid colon, and then the sigmoid colon and rectum. So what is the investigation? Double contrast, barium air, barium. Double contrast enema. You put the enema from inside and you see air and the contrast. What parts of the colon are retroperitoneal? So retroperitoneal are the ascending colon. What you see, this one is ascending colon, descending colon, and these flexures. This flexure is also retroperitoneal. This flexure is retroperitoneal, as well as rectum. Then peritoneal relations of the rectum. So upper part, middle part, lower part. Upper part from front and the side, middle part only front, lower part is so what abdominal pelvic structures are intraperitoneal and what are retroperitoneal? So this is about fifth abdominal. So stomach, first part of the duodenum, intraperitoneal, stomach, duodenum, major parts are retroperitoneal and intraperitoneal. Retroperitoneal, kidneys, ureter, renal gland, ascending, descending, second part of duodenum, third, fourth duodenum, vena cava, aorta, lymph nodes, bladder, vagina, all are retroperitoneal. Intraperitoneal are stomach, duodenum, jejunum, ileum, transverse, sigmoid, tail of the pancreas, appendix, cecum. These are intraperitoneal. Gallbladder, uterus, ovaries, all are intraperitoneal. What characteristic help to distinguish jejunum and ileum? Jejunum is darker in color and ileum is also thicker and has got more vascula and long vasa recta, less fat. Distinguishing large bowel and small bowel. Large bowel obstructions, appendico, and there is tinea coli as well as large lumen. So this is a structure of the liver. This is right lobe, this is left lobe, you are seeing. This one is the gallbladder, cystic duct, common bile duct, and then you get ligamentum teres, falciform ligament. This is inferior vena cava, this is caudate lobe, and this is quadrate lobe. Then you get a portal vein, hepatic duct, and hepatic artery. Structure C2K. Collat's triangle is formed by the common hepatic duct, cystic duct, base of the liver. Boundaries of epilobic foramen, you get above is the liver, posteriorly behind is the inferior vena cava, anteriorly free edge. What structures are squeezed? Portal vein and what is used for? Pringle's maneuver. And this again the picture, this one is showing ERCP, endoscopic reticular. This is a pancreatic duct, this is a common bile duct, this is hepatic duct, this is cystic duct, this is right hepatic, left hepatic, common hepatic and cystic duct which form common bile duct in opens here. Parts A to J, where does common enter the bowel? Medial, posterior middle side, administer control secretion, sphincter of Oddi. So this one is the spleen. What you see, the inferior surface of the spleen. This C is the anterior part. This stomach is like this. A transverse colon. The kidney is posteriorly, most posteriorly. Then this one is the splenic flexure of the colon. B is splenic flexure, anteriorly stomach. This one is the kidney. And here is the tail of the pancreas. So this is the posterior border, this is the anterior border. So it's normally palpable when it gets double. What is the organ? This is spleen. From which side of body? From which side of the body is this? Left side of the upper abdomen. What organs have left impression A to D? Which is the organ normally palpable? No, once it becomes twice its enlargement, double the size. Supine position, what part of the abdomen is most dependent? Morrison's pouch, it is a hepatorenal. What is collections happen here? What structures make up the rectus sheath? So above the arcuate line, rectus sheath is formed by anterior and upper layers. So through which layer there is during midline laparotomy? It's the linea alba, skin, subcutaneous, carpus, transversalis, fascia. So this one is a picture showing the pelvis, female pelvis. This is showing the pelvic inlet. Then this is the sacral promontory inside. Is the lumbar vertebra, L5 vertebra, S1 vertebra. This one is a pubic symphysis. You get a urinary bladder, and this is the urethra. Then you see this is the uterus, cervix, this is the vaginal opening. You get this one is the sigmoid colon, this is the rectum, and this one is the anal canal. Name the structures. What is the name of aperture? Is the pelvic inlet. Describe the different parts of urethra in male. So urethra has got pre-prostatic, prostatic, and then bulbous urethra and the membranous urethra. Then what part of urethra is for controlled blood? Membranous urethra. What is the most dilatable part of urethra? Is prostatic urethra. Least dilatable is membranous urethra. So here you get external urethral orifice. A is external urethral orifice. This is just when you enter inside mucosa of the penile. Then you see the bulb. Here is the bulb. You have to change the angle here. Then once you enter inside, E is the opening of the membranous urethra, and D is this one is the verumentanum. You get H is the opening of prostatic utricle, and I these are the two openings of prostatic sinus, and G is the urethral crest. Then you see the prostate, and this J is the opening of the bladder inside. So this one is the structure of ilium, ischium, and pubic. Three bones joined together to form the pelvic hemipelvis. This is the right hip bone, innominate bone. A is the anterior superior spine. This is the pubic iliac crest. And C is the anterior inferior spine. J is the iliac fossa. Then K is the supposed to be the arcuate line. This is the arcuate line. Then H is the pubic tubercle, and this is the pubic L1. L is supposed to be the pubic rami, superior pubic rami. This is the inferior pubic rami, and then G is the ischial tuberosity. This is the tuberosity. This one is the ischial spine. This is the greater sciatic notch. This is lesser sciatic notch. This is anastomose. With O is anastomosing with the part O and P. O is articular cervical sacroiliac. Here is sacrum, and N is supposed to be represented by the blue shading O and P. What muscle originates from the point J? So iliacus. This muscle is iliacus.